Yes, I've seen it.
Click on it.
Yeah.
It has given you to choose.
Add image or add video.
Yes. Can you able to choose?
I choose which one? Add image.
The one I sent you.
Okay. But it's nowhere here unless I'm picking from. Okay. Do I download it on my PC?
Yes, you have to download it on your PC.
Then let me do that first.
Okay. One day.
Jennifer?
Yes, Tricia.
Has mine set itself?
You know your video is off. I can't see you.
Oh, sorry. 1 minute. I'm okay?
Good. There we are.
Yeah, perfect. Thank you, Paul. You're looking better.
Thank you.
Is David joining us? And Tresha, you chose the wrong one. You downloaded the wrong one. You can see ours are the same. Mine and Paul's are the same.
Okay,
Yours is the wrong one.
So for me, I'm not able to download, right? On
yeah, yours is fine. Is David joining us? Tresha?
Yes, just call. Yes, he's just given me a call.
So
you had already sent him the link, right?
Yes.
You had sent him the link.
No, I sent you. I didn't send him. Just probably can forward it to him. Okay, can we start? Okay. No, wait.
Let me send it to him so that at least by the time we start, everyone has the link. Am I on the right one?
Yes, you're on the right one. Thank you. You're on the right one.
But it's looking my EACRN is upside down.
East, and I'm going to hand over this meeting to Freshia Kagu, who is our host for today. Freshia?
Hi, Jennifer. Thank you.
So she's our host for today. So Freshia, go ahead.
Okay. Thanks, Jennifer. Hi, everyone, and welcome. Yes, as Jennifer, David, yes, and the rest, thank you very much for joining us today. To start us off, I think I'll just give us a brief background of the program we have today. And EACRN, which is a network of civil societies drawn from the Eastern African region, working on child rights, both within the national level, the regional level, and at the African, continental African Union level. So the program today, we are supported by TDH, or the Girls Advocacy Alliance, which is a coalition or an alliance of civil societies, the Dutch, Netherlands, offices of Plan International, ECPAT International, and TDH. So EACRN works under TDH, implementing under the thematic areas of child trafficking and CSEC. And they've enabled us to have this meeting today. So to start us off, since we started implementing this project, we've done a lot in terms of training of civil societies around the areas of CT and CSEC, also bringing in them into the regional advocacy level, the African Union, and the EAC and the IGAD. But for today, we are looking at the area of CT, or around trafficking today, and how that is being affected within the area of COVID. So to help me with this dialogue today, we have Annette from Uganda. We have who is Executive Director of Rehab Uganda. We have Paul, David Gitau, who works with the Anti-Human Trafficking Unit, the Anti-Human Trafficking and Child Protection Unit based in South B in Nairobi. So I think rather than introduce them, I will let them introduce themselves, starting from Annette. You can tell us a bit about yourself, what you do. Yes, yourself, you introduce yourself and your background and what you do. Annette?
Thank you so much, Freshia. I'm so glad to be in this space. These indeed are unprecedented times, but we are all trying our best to do this work. As I've already been introduced, I'm Annette Chidabida. I'm the Executive Director of Rehab Uganda, an NGO in Uganda that responds to CSEC and also trafficking, child trafficking, and also trafficking in adults. Our work is majorly in two areas: in protection work, providing services to victims, but also in prevention work, raising awareness and trainings and sensitizations of communities and various stakeholders. So I think briefly that's what we do. Sometimes we support prosecutions, like taking care of victims as they try to access justice. But our major work is in protection and prevention.
Okay. Thank you, Annette. Paul? Yes,
good afternoon. First, thank you very much for allowing me into this space. I wish to introduce myself briefly. My name is Paul Adoch. I'm the Executive Director at Trace Kenya. Trace Kenya works in the coastal region of Kenya on fighting human trafficking. Our work is basically centered on protection, prevention, prosecution, and direct provision of services to victims of trafficking. And we also advocate for facilitative policies to protect victims of trafficking, and also to ensure that trafficking and slavery is eliminated. Thank you.
Okay. Okay. Awesome. David, other panelist.
Good afternoon.
Yes.
Hello. Hi, everyone.
Hi.
Hello, David.
Hi.
Thanks for this session. And first of all, is to thank the conveners of this meeting. And my name is David Kitau. I work with the Directorate of Criminal Investigations in Kenya, Anti-Human Trafficking and Child Protection Unit. Basically, our work is to investigate and prosecute and also conduct rescue operations for victims of human trafficking, child trafficking, and we also conduct investigation on online child sexual exploitation. Thank you.
Okay, awesome. I think we have a diverse panel today looking at what I'm loving most is that all of you have a first-hand approach to the work around trafficking, both Annette, Paul, and David. So I think, as we note currently, COVID-19 has affected how we do things today. It's no longer, and especially Annette and Paul, as you say, you're in the area of rescue. You're also doing protection of children. But we would really like to hear from during this area, around this time of COVID. We know due to the safeguarding measures have been put in place, no longer able to keep on movement is an area that is difficult right now. Also rescue or even for safeguarding measures in itself is giving us a bit of issues. So we'd really like to hear from you. Maybe I'll start again, or I'll start with Annette. In terms of child protection currently, and what has or how has COVID impacted your work at the moment? Hi, Annette. Yes. How has COVID impacted your work today? As an organization dealing, yes.
As you have rightly said, it has affected most of the R's. I think most of us have a model where we have rescue and rehabilitation and reintegration. Rightly so, because of the protection guidelines provided by our various countries and spaces, like for Uganda, people have been in strict lockdown and movement is limited. And so to try and prevent the disease, people have not been moving from space to space. And so the rescue of victims, I think in the beginning, in the earlier weeks, even the reporting of cases, people had gone quiet. But lately, there are phone calls of incidents. I think in the past 24 hours, I've received about 3 phone calls, interestingly from the public, which for me was a good thing. For instance, somebody called me and said, I've driven past this place. I found your number somewhere in the newspaper. You do this kind of work. And I've seen some children from Karamoja. If you know the story of Uganda, we have quite a number of children on the street. What are you able to do about it during this season? And so I told him, as an organization, currently we're not able to take in children. But I also told him that I know about organizations that have been responding particularly to the children from Karamoja, and also some of the efforts that have been put in place by government to get the children off the streets and put them somewhere. So really rescue is difficult during this season. It has layers and layers of difficulty as children continue to be vulnerable. The area of rehabilitation is also affected. Before different teams are able to move back and forth and provide support and provide care. But I think we just have like a skeleton staff taking care of the girls like we have at the shelter. and they're not supposed, the rest of the other teams are not supposed to access them. At least they were not supposed to access them. And even if they wanted to, there is no, we've had no public means for teams to travel back and forth. And so that has really, really been difficult, trying to provide as many services as possible. Of course, like for children, they are not in school. Some schools are not privileged to have e-learning and all those things. So they're really supervising, self-supervising with whatever work they have and what is being aired on TV. If they have a privilege of TV, at Rehab, I would say we have a bit of TV. So there are a few lessons there. So you can see also education in one way or another has been hindered. So the area of rehabilitation, of counseling, I think I remember when the earlier weeks of the lockdowns, people were a bit agitated, but we have done lots of phone calls and counseling by phone, and I think the nerves have come down. We had children ready for reintegration. That has not been possible because we can't access the communities, and we also cannot, I mean, there's no public transport, but I think also the communities need preparation. So yeah, in a way, the protection work has been affected. But also the prevention work has been affected. Yes, please.
From what you said, we are having children who are still being raised. I'll be curious to understand what are the measures that the Ugandan government has put in place to protect children during this time, and also as we rescue, considering we are all trying to have the social distancing, avoid mixing, the children, maybe those who would be already in the shelters with those who are coming in. What exactly are the measures that, or child safeguarding measures that have been put in place by the Ugandan government to protect even those children that are being rescued at the moment?
I think the general measure the government put in place was to have all children out of school, first and foremost. Go home. Yes. And then from home, parents, caregivers, shelters, those generic, guidelines ensure that children are safe. They are not loitering in communities and whatever. For the girls at the shelter, for instance, like Rehab, they are in one place. They are all well. They are all okay. No one is leaving the shelter, of course, and no one is coming in. That has its advantages that you're not being exposed, but also it has trauma. When you limit people, that's when they almost feel they want to move. So that in itself. But also generally, children in communities. Some of our African communities are so, people live so closely together that the whole issue of social distancing is difficult. Yes. As much as government has given the general rule, stay home and what, but for some people's home, the spacing, the social distancing is very, very difficult. And that actually, I've noticed in some of the neighborhoods, that it pushes children to try and walk around. And there's this illusion that if I know my neighbor, maybe they are not sick. There's kind of a psychological comfort of knowing somebody and not even putting the safeguarding guidelines in place. And that's really, really a huge gap for children. If they find themselves in very confined spaces, even just the pressure builds for them to want to move out, and then they get more exposed. But like for the ones at the shelter at Rehab, at least we know that they are not making contact with outside, with other people outside.
Okay. And I think, well, the measures or the lockdown seem to be both Kenya and Uganda. And if anything, I guess, like Kenya, it was one day in the afternoon, we went to work, then one day in the afternoon, it was announced that there will be a lockdown in Nairobi, Mombasa, and some cities within Kisumu. So I'd be really interested to also hear how Paul, as an organization working in Mombasa, amid COVID, how again COVID has impacted them at the coast, or even as an organization, as you try, as an organization doing service delivery, as you try to reach out to the community, to the children, how has COVID impacted your work? Hi, Paul, your microphone is off. You need to switch on your microphone.
You switched me off. You switched me off. Can you just? Am I back on?
Sorry? Yes.
Am I on? All right. Thank you very much. As I was saying, our programming as was before drastically changed the moment we were put on lockdown. But there are several things that were put in place quickly to try and support children who are likely to be in distress. The government and members of local network, the county network for Mombasa in particular, came together to quickly seek issues of addressing this and forming solidarity in order to protect children. We quickly found out that government had placed procedures and protocols on rescues and taking children into existing rescue facilities. And therefore, that particular process had to be stopped because children who are already either in children homes or in rescue centers do not get further visitors from outside so that they are protected. However, it has also made visible other children who are very vulnerable, and specifically children on the street, children, orphans and vulnerable children in urban centers, children who are in forced begging also in urban centers. These ones have become much more visible than in the past. Our response has been to, again, work through the Child Rights Network, particularly for Mombasa, in responding to that. We are fortunate a bit because we also work in rural areas of the coast region, and there there's a difference, in terms of response, and also the beauty of distancing. They do not suffer it like we do have it in Mombasa, where housing is close together, but the house in the rural setup, children stay in the farms, but unfortunately in the rural centers or rural areas, information regarding COVID is harder to come by. It comes only in two ways. First, through local individuals who travel to any of the centers or urbanized centers in the rural area, who give that information, and information that comes on radio that usually may not be articulable to children. They do not quite understand it. So this has been evidenced by the trauma experienced by children and the calls that they do send to us once in a while to explain their circumstances and also to seek more information. So that has been the two major effects on rural and urban children in our area of jurisdiction. But there's an added matter that we fear may be happening, which is also relating the gender-based violence that we see in people closed up together. And though this is still anecdotal because it's still early days, but we suspect that children are suffering internalized violences, within the family. It could be sexual violence through access to digital media now for children who are seeking to do their homework on books. And it's also violence of children in the rural community where households have lost income, and therefore children are sent to do petty trading and to work on the farms so that they can earn some money for the household. So these levels of violence is being witnessed. And again, as I said, it's still early in the day, but information trickling in suggests that is what is happening. But I dare say also that between adults and children, our children seem to be a lot more disciplined in terms of following up on what they are told to do. For example, stay home. They seem to be staying home more in a constrained manner, apparently more disciplined manner than the adults. So those are our observations so far.
Mm-hmm.
Right.
Okay. Well, it's interesting that you should note that they still increase cases of trafficking because for there to be trafficking, there has to be the element of movement. But you're disputing this in a form of saying childless. Can you explain? Annette had explained where you had a population of children who you had either rescued and yes, do you have children? And I guess as knowing that we don't know how long the entire situation will last, for how long, I guess what measures are you putting in place as CSOs? We all know CSOs we are mostly donor funded, and I guess we are funded for a period of time. But I would like to understand what measures are you putting in place as a civil society now, still in the rescue and the placement, in case this happens maybe or COVID continues. It's been an abnormal that seems to be our current norm.
Let me
time being. But what measures are you taking as a civil society? Yes.
Thank you.
Okay.
Let me just pick it up from there. First, our contention is that trafficking is happening in a different form, in the sense that there may be no physical movement of children from one place to another. However, children are now cooped together with potential perpetrators. And in the next number of months, when things sort of open up a little bit, evidence of this will come out, because children are telling us that they feel cooped up and there's nowhere else to report. All the resources that could be used for protecting children are now being used for response to COVID. This could be police cases. There's no rescue centers anymore. And the children who are stuck where they're just stuck there for the time being. So that's one. So issues on sexual exploitation of children, including incest, will soon become apparent with time. The second level of trafficking is online trafficking, where children are now accessing digital platforms, of course, purportedly to do education revision, but with time, this is the time for traffickers. They now enjoy this because this is an opportunity for them to link up to children where digital platforms are not secured and where children images are probably on a platform such as the one we're using. So here then, when there's a link on the side for a child to click on and they have the whole time to do it, they'll then become more vulnerable. In terms of our response, we have two responses. One, we've requested our partners to rechannel some of the resources that we have so that we can do what we call an emergency response to children, vulnerable children that we work with. And all of them have been gracious enough to allow us to redirect our resources for that. Basically, just to meet immediate needs of households, because children live within households, just to help them just see a number of days and see the weeks go through. The second level is we are using our counselors to reach out to children on telephone, where then if a child reaches us either by flashing, or they just flash us, then we're able to talk to them and counsel them on phone. And this is picked up also by us deliberately making follow-ups on the children that we already had enlisted in our program. So it's a deliberate thing that we are doing during this COVID situation.
Okay, that is great to hear. And I think, as you said, the online sexual exploitation is one of the current fears or one of the forms of trafficking that is mostly or will increase or has increased during this time. And I think this is a good time for David to tell us, because at the Anti-Human Trafficking Unit in Nairobi, you handle online sexual exploitation of children. You've also been handling the rescue and from the law enforcement perspective, there is a prosecution aspect of it. So, and I know also the unit is directly linked to Interpol. So would really like to understand from your end, what kind of cases how you're handling these cases, what cases you're getting, and how the situation is, maybe because you're better placed at this point to give us in terms of the cases that you're receiving at the center for the ones you're prosecuting. David?
Yeah, so first of all, the whole pandemic has changed the way we work and how we respond to cases. Since the measures to stem the spread of the COVID were put in place, the restriction on movement, the lockdown in Nairobi, Mombasa, and Kilifi, that has meant that we can't even, we as law enforcement, actually move out of Nairobi, where we conduct rescue operations or conduct arrests. However, we are trying as much as possible to address those cases that have a lot of interest. And our observations in the recent past, especially on the online exploitation and sexual abuse of children, is that there's a spike in the number of cyber tips we receive from the National Center for Missing and Exploited Children, NECMEC, and also the number of alerts from Interpol have also increased. However, when it comes to the other end of the response as a unit, we have scaled down our operations to the almost a bare minimum, meaning that we are responding to case on a case-to-case basis. For instance, those in Kenya are aware of the case of the German who was arrested for sexual abuse and actually found with a boy, and the other case in Kilimani. However, other things that have also stopped on the rescues. So we can barely conduct rescues, and whenever we can, because for those rescue centers that we depend on, they're not allowing any more, they're not admitting any more victims to those rescue centers. So what this means that we are unable to assist victims at the moment. And that's this means that there's actually, well, in terms of trafficking, for example, the pandemic may mean that we have low numbers of trafficking now because there's no movement across borders or no movement within the country. However, what we think in terms of exploitation, the abuse on the vulnerable or those who are already in the country and were unable to make their way back to their respective places, the abuse might be more. Yes, and then the other one is on reintegration. So before the COVID pandemic was started, we were due to repatriate a number of victims to both Uganda and Tanzania. So that those processes had to be stopped, and so that has limited the pandemic has really limited the way we work as the whole Directorate of Criminal Investigations and as a unit. But we are archiving those cases, and we are trying to respond and work with law enforcement in those places where these cases are reported from to try and address these matters. For example, we have a case in Kitui, and we are trying to work with the local administration and also with the local police administrations that is based there to try and assist the victim first before we go for the offender. The courts initially were locked out, but now we are able now to actually present our cases before court. There were categories on which cases that were supposed to be taken to court. However, that we've seen due to the high level of violence against children cases that are coming out from households due to the stay-at-home orders and the number of domestic violence cases that are also occurring. The discussion was upscaled all the way to the Office of the Inspector General to actually push for the prosecution of offenders because of the spike in this kind of cases. Yeah.
Okay. Let me ask. Thanks, David. But let me ask. I think it's worrying when we hear that it's impossible to rescue, or
Yes.
we have those children who are already in those situations, but
Yes.
there's what can say little that can be done. Because I'm wondering, what is government, or what are the measures you think that government has put in place, or what exactly? Because we can't. Yes, our hands are tied in terms of movement, in terms of rescue, in terms of integration. But what
Yes.
is there either a plan on how to either rescue these children who are in those situations already? We've
Yes.
seen stories of children who've been trafficked into the countries, especially when it came to the Tanzanians. It was those children who are living with disabilities but were begging on the streets, but now are stuck in the country. Or we had the Ugandan, the cases of the Karamoja girls. But now my question is, what exactly, because these are cases that we knew existed. They were there before even the pandemic.
Yeah.
But what exactly now is being done, or what measures are being put in place for these children? As much as we say the rescue hasn't been done, but what measures we have in place for these children?
The directive is to do as much as we can. So the whole pandemic has changed the way we work. So first of all, even before we go out to rescue, and we have to take precautions to protect officers too, and protect everyone who's going to be involved in those rescues. And also, the amount of resources that are now available for such operations are a bit limited due to the COVID. That is, all the resources by the government have been directed to curb the spread of the COVID. However, the government has instituted measures like just working with local administrations in those places now that we in Nairobi cannot make travels to counties like Mombasa, Kilifi, and wherever those cases that are happening. For instance, we have the lockdown in the whole Karamoja story, and the whole Karamoja victims who are mostly found in Isli area. It's now harder to access those households where those victims might be. But the directive is from the director and from the officer commanding the unit is that we should actually be proactive, since now we do not have any more reported cases to us from those areas. The information is not coming through the areas of operations, like the country bus station where these victims come through, no longer in operation. So the information is not trickling in. However, the directive is for officers to be proactive and try to gather intelligence through friends in CSOs in those areas. And whenever we've come across a victim that needs to be rescued, the protocols on COVID have to be followed. So we are not taking we are not taking victims to the rescue centers that we worked with, the ones we collaborate with the civil society. However, the children homes are open, and however they have to follow the precautions that the government and the guidelines that have been laid out by the government in terms of testing and protecting other victims in those facilities.
Okay.
Yes.
Let me during this time, I guess, from the CSO's perspective, what would you require civil societies, or what assistance would you be requiring from the civil society?
Mostly it's information. Yeah. Sorry. Information.
No, just go on.
Yeah, we have seen a reduced reporting to our unit since the start of the pandemic. So that is one area. And then the other one is on victims. We have there are limited resources on victim support. So CSOs could support those facilities where these victims who are rescued are actually placed to enable them have a comfortable stay in those places, because the nature of children homes in Kenya is not at par with what we have or what we work with, but what is provided by the CSOs. The facilities that are provided by the CSOs, which we can no longer access for now.
Yes.
The other area is on counseling. Maybe some of the CSOs who have counselors could volunteer those people to counsel those victims. Yes.
Okay. So in terms of civil societies, if I understand, it's civil societies assisting or giving you information.
Yes.
Around maybe now this time around tracking or getting these cases may be difficult, and also counseling.
Yes.
Okay. For all of us, I'm seeing. Thank you, David. I'm seeing there's a series of questions. Jennifer Stelling, that are coming from the attendees who are in the meeting. I haven't managed to go through them. Jennifer?
Yes.
Had you managed to go through the Q&A? All right.
Yes, I have. And there are quite a number. We have some on Facebook and we have on YouTube also. We have a couple of questions. So I'm going to start with the ones which are in the room. We have about 50 people in here. So I'm going to start with those questions, and then we can respond to them, and then we can move to the ones on YouTube.
Okay. Sounds good.
So sorry, my assistant here is wants some attention. So we have a couple of questions. Let me just so there's these questions from someone who is saying anonymous. They're saying, I'm curious to learn how the various measures we can put in place to remove children who are in harm's way, that is victims of trafficking, and yet still protect them from COVID-19.
Okay. How do we protect children who are in harm's way? I think that is the same question I was asking David. Because we have children who are already in this situation. How do we protect them? And I guess, Annette, I can ask. Hi, Annette. I can ask, even in Uganda, as government, as we rescue these children, or even as we try to work with those children, maybe who are still need rescue, as you rescue, are you doing this? Will the cost be at an individual level, or is government offering assistance in terms of the medical care and the checkups for children?
If any rescues are happening, of course, there's been like today, I heard the Minister of Youth tabling to Parliament that are off the streets. I think all have become evident now. So I saw her asking for that money, and maybe she will work through certain partners, that I'm not sure. But currently, most of the CSOs, if they are to rescue, they would use their own resource and medical and access medical for the children the way we usually do, because we haven't seen government come in to support us, unless if the minister gets the money and then they partner with some of the CSOs as they will choose to work with them. I know that currently there are certain CSOs that have been supporting the program where they've been putting the street children, and in place, I mean, there's screening and ensuring that there are case managers and people taking care of the children there but then that has to really, really be beefed up. I think one of the other things that we might be experiencing, there's been a bit of an ease in movement. I think that is where the CSOs would need to be supported, because we've had a time where the movement was very difficult to reach people who cannot be easily reached and all that. So I think there's need for government to arrange, because like in Uganda, we had what was called the essential services. And most of the children's services didn't seem like they were essential services then. But as different debates have been coming up and different needs surfacing, I think people working with children, organizations, whatever, need to come on that list that government can gazette as essential, receive permits, so that if there is need to move and rescue and have children looked after, that would be eased. But I know that most of the services the CSOs provide do not necessarily receive.
Okay. Yes. Thanks, Annette. I think that's a very great idea in terms of having civil societies or those who are within the children's sector gazetted as part of the essential services. I think I will also ask Paul the same question in terms of what do you think we can do for children who are already in this situation while still trying to keep them safe?
What we've done, and I'll give the Mombasa example, is that we quickly called a multi-stakeholding meeting, which was chaired by the Department of Student Services, and the coordinator then got ideas from all sector players. What our decision was that we put all children that are vulnerable in whichever way in situ, within confines of their areas. For instance, children that are in children rescue centers and children homes stayed there. Children that were in school went back home with their parents. Children that are on the street, living and working on the streets, are then supported from the streets where they live and work. And as long as they are confined there in that specific place where they normally congregate, where they go to sleep, then it is there that all other services are provided. All the players that work with children that live on the street can then provide food, medication, or any other services there. Our only fear after a while was that what if one child catches COVID? So far, I'll say it in Arabic, inshallah, nothing has happened so far. However, we've sounded out this to the Department of Children Services. The coordinator is aware, and since he works directly under the county commissioner, who are co-chairs of the response mechanism within the county, then it will be possible to feed in this response to the existing either quarantine facilities or medical facilities that the children may get. But for now, the children, remember I told you much earlier, it has now made us notice children that have always been there, but they are less visible. Now we know they are there. And the biggest fear is, what if they catch COVID and then they spread it to the other community, members of the community. So that has been the fear, but fortunately it has also offered the solution to protect them for the time being in the places where they ordinarily domicile. And that is what is happening so far.
And maybe to add to what Paul has said, there are parts like we've seen in Eastern Uganda where the children were put in one place, children from the streets, and they were making arrangements to screen and test them. I haven't followed up that situation to see whether that has been done, but definitely that would be ideal, the screening and testing, especially of those vulnerable populations of children. But we all know that most of our countries, do not have as many tests as they would love to have. So that would be a major hindrance. But that's something government can also do, especially for children who are not rescued and are finding themselves in pockets of living on the street of vulnerabilities in other, not just the capital city, but also other towns and even rural areas, because it also feels like the COVID message seems to be maybe more understood in the urban areas, but people in rural areas are continuing, some of them continuing to go on with business as usual. So even the messaging needs to reach those areas so that the vulnerabilities of particularly children can.
Okay. So from what I'm understanding is that we still need to do, or there's still the gap in terms of advocacy, especially in the rural areas. But also in the urban area, the children, especially those who have been living in the streets, have now become more vulnerable, to say, if I may put it that way, than they actually were initially, because now we are saying, like in Kenya, I know we don't have a lot in terms of rescue centers or places where we can place these children. A lot of the areas or the centers we have are mostly civil societies. As David had put it, you work with civil societies who have shelters, but the government ones are few, and those ones that are there usually are the ones that are attached to the courts. So the children who are still now living in the streets or connected to the streets actually become a class and let me say more vulnerable than actually they initially were before COVID. And these children actually there are children that actually need special attention, both from the civil society and the government. I guess, Jennifer, as we are taking notes, can perhaps go to question number 2.
I can see people are lifting up their hands. Unfortunately, we cannot allow you to talk for security reasons. So please just type your question in the Q&A section at the bottom there. Please just type your question. We cannot allow you to join in because of security reasons. So the next question comes from Florence. Florence, I don't want to pronounce your second name. So sorry if I pronounce it wrongly. They say, an addition, Ugandan government, I think this is just a comment. They're saying Uganda government has given directives to the effect that all new intakes to a shelter must go to be tested. So which is a good thing for Uganda. And then there's a question from Nemo, which I think it's relevant for all of us. He's from Somalia, but it's relevant for all of us. He's saying, I hope, sorry, it's a he or she. Sorry if I mistake your gender. Hi, everyone. Thank you for this webinar on the impact of COVID-19 on child trafficking. However, there's a real area that I feel that is left out. Rural children are internally trafficked for child labor to work in small agricultural sector. For example, in Somalia, children are used in livestock production and forestry, and this is driven by poverty. I think this is common to all of us. Where in Kenya, they come to Nairobi to do domestic work or child labor in the farms. So I don't know, Pressure.
Yes. Yes, I agree with you, Jennifer. Children traffic, but I think she's talking about it in the context of the rural areas. In urban areas, when we have child trafficking, we mostly find them in domestic work, commercial sexual exploitation, children who are begging on the street. But the class that is mostly left out, especially in the rural areas, or is those children who are mostly within the coffee farms or either cattle, who are taking care of cattle. So yes, I think it's also another class of trafficking, or children who are also vulnerable during, or another form of trafficking that maybe will come up now, or maybe a bit more visible during this time, because when we talk about trafficking, most of the data, even the one we collect, tends to be mostly within the urban areas. So unless anyone, or maybe from the panelists, you have a comment on that?
Yeah, I'd like to comment on that.
Yes.
Nemo's observation is also true for coastal Kenya, in that, as I mentioned earlier, more and more children are being taken to do farm work, particularly farm work, so that they can boost family household incomes. But you're also noticing that in the further distant counties like Tana River and lower parts of Lamu, and the further districts of Taita Taveta near the borders with Tanzania, is increased cases of domestic servitude, where children are now being made domestic house helps so that they can boost household incomes. There's also evidence that early child marriages will increase in the same area, particularly in the areas where traditionally early child marriages exist, because now there's no one to really police this As rightfully noted, all resources have been centered towards the health matter of COVID.
Okay.
So, okay, I would also like to add a comment on that. My observation, moving around the counties neighboring Nairobi, that is Kiambu and Murang'a. Early morning hours, you will see large numbers of children and adults moving to coffee plantations to pick coffee. So that means there's an increase in child labor in those in coffee plantations in around those areas, and also in those areas there's a high level of activity in avocado picking, and a number of underage are also involved in those activities. So with the pandemic, there's reduced income for families. That means now children are being forced to go out and actually eke out a living by doing those activities.
Okay. Jennifer, thanks, David.
The next one, I think it's, yes, I think, sorry, I'm here. I think the next one is just a comment. And the comment is, I think it's a question. What can we do to the parents who send their children to shops during the curfew time? As we know, in some countries, we have time limits, and if they send them, they cannot come back home. So we thought that they're in police, but they fall in the hands of trackers. I mean traffickers. I think that's what traffickers. What can we do? And I think this one, David and probably can be able to answer that. So where children, they are being sent out for curfew, but instead of going, they get trafficked. So yeah.
So one is that children are not going to be placed in quarantine facilities when they're found out there. So the first point of reference for law enforcement when they come across children is to actually look out for their parents, and for that we can actually charge the parents with neglect and issue them with bonds, and for them to report at a later date to police stations. So that is actually been undertaken across all areas in the country. The directive is that children found out during the curfew hours are not to be arrested and taken into quarantine facilities, but police officers should actually trace parents. For those who are being trafficked, maybe internally the same procedure will follow. That is, if they've been trafficked from one county to another and we cannot actually be able to trace their parents, the guidelines by the government on testings will be undertaken, and they are placed in children homes in coordination with children officers in those sub-counties.
Yes, right. I guess it also brings in the question or the comment that Annette had raised earlier, that civil societies, or even as the entire sector at child protection changes himself of COVID to children. I guess I agree things in terms of rescue. It's an advocacy area, I guess, for civil society, because parents are still
Pressure.
Lost you.
I think we've lost you. I'll go to the next question as she's coming back. The next question. Okay, you're back.
No, it's you. I was saying you can move on to the next.
So, David, you seem to be a very famous person here. So, even the next 3 questions are yours. So, I'll just ask them and then you can respond to all of them. So, there's Nemo back saying there's little resources available for CSOs to handle such cases. And would like to know how David at the DCI is handling these cases. So the next question is also on online. I think something you have mentioned, the increase in online child exploitation because of COVID. So do you have evidence? Is there data backing that? So someone Job from TDH is asking that question. And then David also. David, I think this is something that you need to jump into. Someone is saying, how can CSO partner with you, David, especially when urgent cases reach us after curfew hours? So, David, all those questions are yours. And I think there's one more on YouTube. Let me check the YouTube one. I think it was also yours. Yeah. So how are you monitoring the misuse of social media by traffickers? And then I think the next one also, I think the next part of that question is, I think we'll go to either Annette or Paul. The question is the role of parents and caregiver in upscaling and monitoring. So I think, David, start with your list of questions. If you forget, I'm here, I can help you recap.
So I'll start by addressing the increase in the amount of online exploitation that's occurring on the web. So generally, our observation even before the COVID pandemic started is that whenever children are at home, there's always an increase in online sexual exploitation activity. This goes by the amount of intelligence we receive as a directorate. So currently, we have all children at home, and we have a partnership with the National Center for Missing and Exploited Children, and the amount of tips that we've been receiving from them are actually on the higher end. Also, the amount of intelligence that we are receiving also from our headquarters is also high, and anonymous reporting by the members of the public has also increased. So that is one of our observations during this pandemic, is that there's an increase in the number of sexual exploitation cases, online sexual exploitation cases, or child abuse cases online, with the increase in the online access by children at home currently. And on the issue of the retro resources, it's the same for us as police, because the government priorities are now on the COVID-19. However, we are, as a directorate, the director has made it a priority in addressing cases on children cases and domestic violence cases. And actually, we launched a campaign recently that being at home that should not mean that we should be at risk. And so we have at our disposal the country network of the CID offices, and they've been alerted on having to address these cases whenever they are reported, and whenever they need an advisory role, they can always contact the units at Nairobi. So that has been communicated to all the field offices, that all children cases and all domestic violence cases should be prioritized. On partnership with CSOs, there are many ways we partner with CSOs. We've partnered with Trace Kenya, we've partnered with Love Justice, we've partnered with H-Rights, on different things, on rescues, on reintegration, on counseling, on shelters. So it depends with what the CSOs or as an organization offers. So we say our offices are open and we allow any CSO to come and work with us as police, as law enforcement. I don't know whether I left any question.
There is one that you have left out.
Yes.
Just a minute. The question is you've mentioned the evidence one. So there's a whatever a build-up question there. Someone same job is asking what some of the online trafficking platforms. So like from your data that you have just mentioned, the increase, is there data showing which platforms have shown an increase in these cases?
This could be a follow-up of another meeting because we had to compile the whole report and do the analysis of since the pandemic started. But once we've done that and we have the report, we can always share with you and with the data and how and what it's showing. So this could be in a follow-up meeting for this, and once we are done with that, we will be able to share how that looks like, whether it's on Facebook, whether it's via WhatsApp, whether it's on other social media platforms, and what the indicators look like.
David, I don't know, but all these questions are all yours. So there's another question here. Thank you, Ngoti. The question is, how exactly would you wish the SCSO or CSOs to support Child Protection Unit in offering counseling to the victims of trafficking?
In terms of counseling?
No.
Sorry? Hello, could you please repeat that?
A question regarding how CSOs, how would you like CSOs to go about assisting you in terms of support? Hello?
I didn't get you.
You can hear me now?
Yes. Go on.
The question was, how can civil societies, I think it's a build up to the question on partnering with the anti-trafficking unit. The question is, how can civil societies assist you in terms of offering psychosocial support or counseling services to these victims? How can they go about it?
So one way is by directly contacting us, and we would directly link them up with our clients who are our victims and actually offer this. This has been done by one of our partnership with Equity Bank, and they've actually come in and paid for those counseling services for some of our victims with their program on Wings to Fly. And so on the other one is that we get calls for such services, and we could link CSOs that are offering such services with those victims. And this could be done online, could be through telephone, or it could also be physical. So that could be easily done by actually linking up the CSOs that are offering those services and the victims who need those services.
Hello, sorry, I am stepping in. My name is Anita. I'm stepping in for Jennifer, and there are a couple of questions that are directed to Paul and Annette. One is, do you have any evidences of cross-border movements of children during this COVID-19 situation, if at all? Because, I mean, of course, movement is limited, but has anybody or within your networks, have you heard of any issues around cross-border movement of children? Secondly, what would be some of your key asks to governments of Kenya and Uganda specifically in relation to addressing child trafficking and child sexual exploitation? Some of the key asks that you think the government should do to address the issue. Lastly, in relation to children with disabilities, I've had others. I mean, and we know that these are children that are particularly vulnerable to trafficking. They could be harbored and not necessarily moved during this time. They could be harbored in homes and different places. Have we had any incidences, particularly of children with disabilities, being trafficked or being exposed to any other forms of exploitation, sexual exploitation? Thank you.
Okay. This is Annette. I'll try and about having evidence. Right now, evidence is difficult to say that I've had this hard evidence, but given the nature of exploitation and the pull and push factors, even if we know that movement is not officially permitted, we know that usually when there are push and pull factors, there could be movement. And particularly, we have seen our governments work on porous borders. Those definitely can pose a challenge in the area of seeing children being trafficked across borders. We know that most of our East African countries, or at least I'll speak for Uganda, we have been struggling with the whole issue of porous borders. That in itself is a factor, kind of hard evidence that there have been children trafficked across the border. But we definitely suspect that that has been happening, or children are vulnerable to that, because even children might be easier to send to sneak back and forth, further exposing them to situations of exploitation across the border. You asked what a major ask is, government. I think there is a call to kind of focus. I know that COVID is a new pandemic that came to all of us, and suddenly everything kind of went into survival mode. But now that groups and governments are regrouping, I think it is important to refocus the energy and prioritize child protection. Someone was asking whether there are children with disabilities who may not be able to move. As we all know, that trafficking is not about movement, but to step up surveillance and monitoring. Because I think as law enforcement, as David can acknowledge, law enforcement penetrates communities much more today than the rest of us. But if the agenda of child protection is brought back, because the first agenda was people, let's protect ourselves against COVID. The other agenda is the whole food insecurity that is in our communities. But as if priority is brought back to the table and focus, the initial shock, yes, we are still managing COVID, yes, we are still managing food insecurity and all those things, but prioritizing, because once you bring something and it gets to your priority list, then you look at it with a different eye. Even if you're moving in a community enforcing curfew, your eye will see the child. If you prioritize it and you're moving in the community and maybe you're doing a food distribution, you're able to focus and see. So I feel energy was drawn from that and attention was drawn away from child protection issues. That needs to come back to the drawing table. And as different leaders and different players move in the community, most definitely when you talk about children with disabilities, sometimes they're difficult to detect because some families might hide them. That is a priority. And I think there was even an earlier question on the role of parents and caregivers. I think all of us collectively, we need to come up with more creative ways of bringing back the message. As much as we're talking about the sickness and being free and safe from the sickness, we can still bring in the whole aspect that it's not just about COVID, but also their children, and bring messages in ways that maybe radio or TV. And of course, we know that some people are online, but we have quite a big number of our community members that maybe might not have as many MBs for videos, but just have creative ways that we are narrating the message and coupling it with the message of the pandemic so that people remember that, oh, there are still other issues that particularly make children vulnerable, families less able to look after their children so that they can look out a bit more.
Thanks very much, Annette. I think there's a follow-up, Jessica Benakio, who's saying that there was an incident of child trafficked from Mbale district in one of the districts in eastern Uganda. And this child was trafficked for sacrifice to Kampala. So she says that still there is need for more advocacy on the impact of COVID-19 in the rural areas. And I think this was confirmed by, the assertion that Paul also said, that in the current context of Kenya, particularly children being involved in the domestic servitude in the rural areas. So because the rural areas are difficult to monitor, so children are likely to be trafficked within those contexts and to be used for other purposes of domestic servitude. I think what would be also interesting is if the other participants would share if at all there are other stories or incidences of children being trafficked, particularly in the rural areas. I think that would be really useful for us to think through and some targeted advocacy because trafficking, as we know, it's difficult to understand and or to make out unless you are aware of the context or the incidences or how it occurs within in relation to particular victims. So thank you very much, Jessica. And maybe do you want to make a comment in relation to that, Annette?
I think Jessica is very right. What we're all saying that, like the stories, Anita, I think you're talking about people bringing out the stories. I think the stories are the evidence we currently have. The phone calls that people receive for rescue, the phone calls we receive in situations of domestic violence, where children and maybe mothers need to be rescued. That's the kind of evidence we have. But most definitely, even if we are just speculating, we know that all factors are lining up for an escalation of exploitation, and particularly children.
Great, thank you very much. Paul, do you want to make a comment in terms of, in your view, what do you think as some of the key asks in relation to the Kenyan government? And other participants, please, feel free to share in your views in terms of what we need to do in relation to child trafficking.
Thank you, Anita. My first ask from government will be that even as we fight COVID-19, there are still other populations, particularly children, who will who are currently very vulnerable and increasingly are going to get more vulnerable. We are going to get a bigger population of children vulnerable as a result of this COVID-19. My second ask is in relation to online child trafficking. What happens ordinarily is that when there's child trafficking online, the evidence adduced is then used to arrest and prosecute the perpetrator. However, there's the starting part of it all, where the trafficker grooms the child, for example, tries to befriend them, and once they've befriended them, and given this seclusion that children are using, maybe online alone, that by itself should be considered part of the jurisprudence for and evidence for taking up any person who is trying to slowly groom a child to become then a victim of trafficking. Then I'd like also to comment on the children with disability. We noticed that a lot of the children that are on forced street begging in Mombasa are actually from our neighboring country, Tanzania, and they are used for purposes of begging on the street. During this COVID situation, they are abandoned by their handlers. So it is these children that then we put them together as child rights protectors in their region to offer them support. But the support we are offering them is basically support we are offering to ourselves, in the sense that they should not therefore become then reason why the rest of us may catch COVID, which in itself is the wrong approach. The approach should then be that hereafter there should be more comprehensive support for these children, and also reaching out to arrest perpetrators who bring them down to the streets to beg in Mombasa. Those are my comments.
Thank you very much. I would like to return this to Frecia, who just joined us.
Sorry, guys. Zuku happened. I still can't access questions because I have signed in as my personal. I didn't use the whatever account. So I think Anita, you can go on asking questions because I can't see the questions.
Yes, thanks very much. There's another question from Ruth Juliet. Ruth is asking that she thinks it is important to have a regional response mechanism to addressing child trafficking. And I would go back to the panelists and invite David. How is the anti-human trafficking unit working with the Ugandan authorities as well as international authorities in fast detecting online child sexual exploitation, but also addressing cross-border human trafficking or child trafficking?
So we're actively working with Interpol bureaus both in Kampala and Tanzania and Ethiopia. And our activities during the pandemic have also been upscaled, so we are receiving a lot of intelligence. We've been working with authorities in Germany, with the FBI, and actually one of the successes is the recent arrest of the German national who's actually been recruiting children online, both in Mombasa and Nairobi. So those activities and are actively being pursued through the network we have of the Interpol bureaus in all the countries.
Thank you. Is there any measure of collaboration with the national level authorities within Eastern Africa particularly?
So we have a good working relationship with both Uganda and Tanzania, and we share a lot of information, not just through the Interpol bureaus. And in these times where we cannot make to travel to those countries to conduct investigations, we are referring cases that are coming from those countries to them. So there's a good. It's not already a mechanism. It's not an East African mechanism, but it's a country-to-country working relationship between law enforcement, between police officers and in both in Kenya and Uganda, and police officers in Kenya and Tanzania. So the mechanism is not there yet. So the one we rely on Interpol bureaus, but on the other hand, we also work closely with law enforcement in Uganda and Tanzania, and the working relationship is good.
Okay, I think somebody is making a follow-up comment and saying, David, that I think it would be good at this time to carry out investigations on recruitment of child beggars from Tanzania. I think this is something that has been raised even before the COVID-19 situation. Yes.
Yeah, we've actually, the COVID-19 has actually slowed down those investigations, and we've had a number of successes. We had a recent successive prosecution where we had the offenders jailed for a cumulative sentence of 65 years for a case of forced begging, recruitment for forced begging in Nairobi for a victim, for a Tanzanian victim. On the other hand, I would like to reiterate what Paul has said on traffickers actually abandoning the disabled children who beg in the streets. So with the reduced numbers of people coming into the cities, there's reduced amount of what they get while begging. So, but still the pressure is on from those traffickers to actually meet the targets and the demands. And we are actively pursuing those cases. And we have a number of them under active investigations.
Thank you. There being no further questions, I think I want to hand back to Frecia. Frecia, are you there?
Anita?
Yes.
Thanks for taking us. Yes, thanks for taking us through the Q&A. I don't know, I think as we wind up, because we've gone through, I think, all the questions that were on this, the Zoom account, and I think Jennifer also brought in the questions that were on Facebook. I think as we wind up, I would like to hear a last comment from each of the panelists. That is, I'll start with Paul. Maybe a last comment from you.
My last comment was to talking on the matter of online trafficking. The fact of the matter is that it's spiking and it's going to grow. Children who've been cooped up for this duration of COVID will continue and will soon find ways to meet their potential traffickers face to face sometime in future. It will be important then that as civil society and stakeholders, including government and stakeholders that work in child protection, to be very alert on that, specifically on exposing our children online. The rest of us are taking caution to ensure that we don't even expose ourselves. But as stakeholders, we should let parents know that anytime a child is online, as we are right now, they are potentially victims of trafficking. And anytime they are on digital platforms, they are similarly potential victims of trafficking. So we should work hard towards that direction. Secondly, is to also work first with our governments to ensure then children overall are protected, even as COVID is part of this, because a lot of children come through this very traumatized, and they'll therefore need to be psychosocial support going forward. Those are my parting remarks.
Thanks. Paul, I believe I do agree with you. It's what's happening in the digital and the media space, and especially It comes to true. Can hear from Mrs. Annette still here?
Yes, I am. I keep losing you, Fresher, but I'm here. I don't know whether to speak now, but I keep losing you. Yes, Fresher. Hi, I'm here. My last comments, maybe I'll make 2 comments, is, can you hear me, Paul? Can you hear me? Because I keep losing Fresher, I'm not sure.
Yes, Annette, we can hear you.
Okay, all right.
Annette.
I'll make 2 comments. I think there's an opportunity now that governments are working together to secure their borders. I think anti-trafficking units of Kenya, Uganda, Tanzania, all our neighbors, can use this opportunity to strengthen, because I think we've been struggling a lot with porous borders. And since there's an opportunity now, I think it's something we can leverage as government, and don't go back to where we have been and build onto the vigilance that has come with securing our borders. I think that's an opportunity out of this very difficult time. The other thing I think, as all of us have mentioned, moving forward, to find innovative and creative ways of how we can step up the advocacy among all stakeholders, right from grassroots caregivers, leaders, us as CSOs, to have innovative and creative ways of continuing to bring out the message about pull and push factors. As Paul has rightly said, we anticipate an escalation because maybe parents don't have sufficient funds, they've lost their jobs. So more vulnerabilities for children as households struggle to take care of their own. So we need to find creative ways and step up and use all avenues to send out the message. I know that social media, social influencers, but we have radio and TV. I know all that require resources. I think we also need to think creatively concerning our resource base, as donor areas might shift and resource bases might also shift. We need to find creative ways of diversifying resourcing of the different programs and assistance we provide to children or all our other beneficiaries. And also continue enhancing these online platforms, I think, among East African region or even the Horn of Africa, as we together share information and learning and how best to serve the community.
Mm-hmm. Okay. Yeah. Thanks, Annette. I agree with you that a lot of the effort that the government has put in terms of cross-border efforts and prevention of movement have given us an opportunity and advocacy areas as CSOs that we can use in terms of trying to prevent trafficking. And also, it is also key because COVID-19 has it's a global pandemic. So as CSOs, as much as we rely on donor funding, I think it is also key for us to start now our source of funding and how to diversify our funding in future, because funding or the amount of funding that may be available, it's a question that is ongoing on how much funding will be available to Africa or also to our countries or even our civil societies, because this pandemic or even our donors themselves are dealing with the same pandemic at their home level. I agree with you. We also need to start using the platforms that are available to us, both online, offline, the radio and the media. These are areas that we can use to keep on sensitizing the communities and everyone around the areas of trafficking. Thanks, Anne. David, as we wind up, we can hear from you. Your last comment.
Mine would be to urge CSOs to assist us as law enforcement on awareness and raising and sensitizing our kids.
now you realize that we have more kids accessing the internet and through these online learning platforms. And it's through such access that they will also access child sexual abuse materials or pornographic materials involving adults. And through that such curiosity, they become targets of online predators. So for me, is to urge CSOs to help us as law enforcement in spreading the word on online safety, sensitizing parents and on how to take care of children or their access in online platforms. And then the other one is to share information. I've always reiterated that our offices are an open door policies. We are still open. You can come if you're still in Nairobi. You can call us. If you have any case that you've come across, we'll do our best to address such cases. Then the other one is to seek assistance. So apart from the COVID pandemic, you realize that we have floods in a number of areas within the country. So the vulnerability of internally displaced families will increase the likelihood of children who are going to be trafficked internally. So that's the floods are creating a big pool of vulnerable and potential victims of trafficking. That's all from my side, and I look forward to hearing from all of you.
Okay. Thanks, Ted. I believe, well, one of the questions we will be getting is how to reach you.
Sorry, your connection is really bad.
I know you told them that you have, as part of. Hello, can you hear me?
Your connection was really bad. Go ahead.
Can you hear me now?
Yes.
Yes.
Yes, that's better.
Yes.
That's better.
Thank you. David, I was saying, as part of this, I know the question is, you've given civil societies that they can reach out to you, and your office has an open door policy. So I think we will, for those who will be looking to get in touch with David, I think we can share, or maybe with your permission, we can share with them how to get in touch with your offices at South B. I think that's why you're, or maybe you can just tell them where exactly you're located, for those who may be able to visit.
So we're based at the CID training school. So it's a DCI academy now, but formerly it's well known as CID training school on Mohoho Road in South Sea.
Okay, all right, thank you. I guess as on our end, Anita?
Nothing
Anita?
from me. Nothing from me.
Do you have any last comment?
No, I think my only last comment would be that please write back to us and tell us what you think. I think more particularly at this point, I think we need to be sharing information on what is happening in the different contexts that we are working in. And perhaps we can think of ways in which we can conduct advocacy, particularly around child trafficking and child sexual exploitation. The Day of the African Child is coming up. This is something that we could purpose to highlight during this time if we work jointly. So I think for me it's just to say, thank you very much to the panelists, but to reiterate that, we need to share information as much as possible. Frecia, back to you.
Yes. Thank Anita.
Frecia, are you there? Your connection is really bad.
Yes, Alice, I have no idea what has happened. Can you hear me now?
Yes.
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 Yes. Sorry. I think to thank the panelists for taking their time and sharing with us. And in terms of our way forward, even as EACRN, we hope to keep these meetings regular so that we get to, because we have a platform where we happen to be a regional network, so it allows us to pull in participants from the regional level. So this is not going to be a once-off I would say webinar for us, because we hope to keep the discussion of child protection ongoing. Even as COVID happens, as we have seen, there's so much that is still ongoing, despite the fact that there's still no movement, but there's a lot ongoing in that area of child protection. I agree with Anita that there are a lot of advocacy areas for us as civil societies. You can reach out to us. We can work around, like she has said, there's the Day of African Child, there's the Civil Society Forum. There's a lot that is going on at the regional level, that is both at the EAC, at IGAD, and also at EU level. So in terms of partnership, civil society is willing to partner with us. Please just reach out to us. I think our email has been shared. And I guess I'm going to wind up by saying thank you also to Jennifer and Total News for being our host for this meeting. And I guess because I do not have any other further comments, I think I will wind up this meeting at this point. Thank you, everyone, and to the participants and the attendees, thank you so much for your participation, for your questions, and for keeping us the discussion. Thank you.